Are you making dangerous vegetable choices that could be silently damaging your kidneys? If you're living with kidney disease, the vegetables on your plate could be the difference between slowing progression and accelerating decline. Recent clinical studies reveal that 73% of CKD patients unknowingly consume vegetables that spike dangerous mineral levels, while missing out on scientifically proven kidney protective options. The outdated avoid all vegetables approach has been revolutionized by 2024 nephrology research. Major clinical trials now show that specific vegetables may help reduce kidney disease mortality by 26%, but only when you know exactly which ones to choose and how to prepare them safely. Today, I'm sharing evidence-based alternatives backed by NIH studies and Mayo Clinic guidelines. You'll discover 4 kidney-friendly vegetables that research suggests actively support your kidney function. Plus, 6 common vegetables that pose serious risks most patients don't realize. We'll also cover the breakthrough preparation methods that can make previously forbidden foods kidney-safe. Based on current medical research, proper vegetable selection could potentially transform your kidney health outcomes. Why traditional kidney diet advice is dangerously outdated. For decades, kidney disease diet recommendations followed a simple rule: avoid most vegetables to prevent mineral buildup. This blanket approach left patients with limited food choices and poor nutritional outcomes. Medical research now shows that this outdated thinking may have caused more harm than good. Traditional kidney diets restricted nearly all vegetables due to fears about 3 key minerals: potassium, phosphorus, and oxalates. Doctors worried that any increase in these compounds could worsen kidney function or trigger dangerous complications. Patients received long lists of forbidden foods, often eliminating entire food groups from their meals. However, recent studies reveal a critical flaw in this approach. Research published in major nephrology journals shows that whole food sources of these minerals behave differently in the body compared to processed food additives. The potassium in fresh vegetables doesn't spike blood levels the same way as potassium-based preservatives found in packaged foods. The 2024 KDIGO guidelines represent a major shift in CKD nutrition thinking. These international kidney disease standards now recommend avoiding highly processed foods while encouraging whole fruits and vegetables. The new approach focuses on food quality rather than blanket restrictions. Clinical evidence supports this change. A landmark study following 2,539 CKD patients found that those eating more plant-based whole foods had significantly better outcomes than those following restrictive traditional diets. The research suggests that the anti-inflammatory compounds in vegetables may actually protect kidney function. The mineral dangers remain real, but context matters. Potassium levels above 5.5 milliequivalents per liter can cause heart rhythm problems in kidney patients. Excess phosphorus leads to bone disease and calcium deposits in blood vessels. High oxalate intake increases kidney stone risk, which can further damage already compromised kidneys. Modern kidney disease diet approaches now emphasize individualized care. Instead of avoiding all vegetables, patients learn which specific varieties pose risks and which offer benefits. Advanced preparation methods can even make previously forbidden vegetables safe for consumption. This scientific evolution means kidney patients no longer need to choose between nutrition and safety. Understanding which vegetables help versus harm allows for better meal planning while maintaining kidney protection. Let's start with the vegetables that science shows may benefit your kidneys. Number 1. Cabbage, the ultimate low-potassium vegetable. Cabbage stands out as one of the safest vegetables for kidney patients, containing only 48 to 60 milligrams of potassium per 100 grams. This exceptionally low level makes it suitable even for patients with advanced CKD who must strictly limit potassium intake. Clinical research reveals cabbage's powerful anti-inflammatory effects. The Chinese Women's Health Study involving 1,005 participants showed significant reductions in kidney-damaging inflammatory markers. TNF-alpha decreased by 12.66%. IL-1 beta dropped 18.18%, and IL-6 fell 24.68% in women consuming cruciferous vegetables like cabbage regularly. These benefits come from compounds called glucosinolates and isothiocyanates. When you chew cabbage, these substances activate the NRF2 antioxidant pathway, which may help protect kidney cells from oxidative damage. This cellular protection could be particularly valuable for people with compromised kidney function. Cabbage offers excellent affordability and accessibility worldwide. Priced between 50 cents to $2.50 per head globally, it provides year-round availability with excellent storage life. You can find cabbage in over 100 countries, making it one of the most accessible kidney-safe vegetables. Preparation remains simple and flexible. Raw cabbage works well in slaws and salads. Light sautéing in olive oil with low-potassium herbs preserves nutrients while adding flavor. Avoid store-bought coleslaw, which often contains high-sodium dressings that can worsen fluid retention in kidney patients. The combination of safety, affordability, and proven health benefits makes cabbage an ideal foundation vegetable for any kidney-friendly meal plan. Number 2. Cauliflower, your kidney-friendly vegetable powerhouse. Cauliflower contains only 176 milligrams of potassium per 100 grams, making it safe for most kidney patients. Clinical studies show it reduces inflammation markers by 19 to 20% and boosts antioxidant activity by 25 to 30%. This makes cauliflower an excellent potato substitute. Regular potatoes contain over 600 milligrams potassium per medium potato, while cauliflower provides similar texture with much less potassium. Mayo Clinic specifically recommends this swap for kidney patients. Cauliflower works in many dishes. Steam it to keep nutrients without adding salt. Mash it like potatoes for creamy texture. Make cauliflower rice as a low-carb substitute. These options help kidney patients who also manage diabetes. The vegetable contains beneficial compounds called glucosinolates. These may help protect kidney cells from damage. You can find cauliflower in over 50 countries year-round. Fresh heads cost $2.50 to $5 each. Frozen cauliflower costs less and keeps longer while maintaining most nutrients. Choose firm, white heads without brown spots. Avoid pre-seasoned frozen varieties. These often contain excess sodium that can worsen fluid retention in kidney patients. Stick to plain, fresh, or frozen cauliflower for maximum safety. Preparation stays simple. Remove leaves, cut into pieces, and cook your preferred way. No special techniques needed to make it kidney safe. Number 3. Cucumber, the safest renal diet food. Cucumber offers exceptional safety with extremely low mineral content. At just 147 milligrams potassium and 24 milligrams phosphorus per 100 grams, it poses minimal risk even for advanced CKD patients. The oxalate content remains equally low at 2 to 5 milligrams per 100 grams, eliminating kidney stone concerns. The 92% water content supports kidney function without mineral overload. Clinical studies show 15% better potassium control in patients consuming low-mineral vegetables compared to higher potassium alternatives. This makes cucumber ideal for patients struggling with fluid balance. Cucumber requires no special preparation. Eat it raw in salads, as snacks, or blended into smoothies. The skin contains beneficial compounds, but peel if you prefer. No cooking needed means no nutrient loss. This vegetable works well for portion control. Large servings still provide minimal potassium load, giving kidney patients freedom other vegetables don't offer. You can eat cucumber daily without worrying about mineral buildup. Cucumber grows in over 100 countries and costs $50 to $2 per pound. It's available fresh year-round in most markets. English cucumbers cost slightly more, but offer less bitter taste and fewer seeds. Storage is simple. Keep whole cucumbers in the refrigerator for up to 1 week. Cut pieces should be used within 2 to 3 days. The high water content means it spoils faster once cut. Our final kidney-friendly vegetable combines beneficial fiber with easy preparation methods that reduce mineral content. Number 4. Green beans. Smart CKD diet, vegetable's choice. Green beans contain 147 milligrams potassium and 26 milligrams phosphorus per 100 grams, placing them in the moderate potassium category. However, proper cooking reduces potassium by up to 41%, making them safer for kidney patients. The Journal of Renal Nutrition confirms this potassium reduction through boiling. Studies show patients can consume green beans without significant impact on blood potassium levels when prepared correctly. The fiber content of 2.7 grams per 100 grams supports digestive health without adding mineral burden. Green beans provide 6 to 8 grams plant protein per serving, helping kidney patients meet protein needs from safer sources. This becomes important as kidney function declines and protein requirements change. Preparation matters for safety. Boil fresh green beans in plenty of water for 10 to 15 minutes, then drain completely. This removes maximum potassium while maintaining texture. Avoid steaming or sautéing, which preserve more minerals. Green beans work well in many kidney-friendly meals. Add them to low-sodium soups after proper boiling. Mix boiled green beans with cauliflower rice for balanced nutrition. Serve as side dishes with lean proteins like chicken or fish after the 10 to 15-minute boiling process. Cold green bean salads work well using pre-boiled beans with olive oil and vinegar dressing. Avoid mayo-based preparations that add unnecessary sodium. Season with garlic powder, herbs, or lemon juice for flavor, without kidney stress. While some vegetables support kidney health, others contain compounds that can worsen kidney function. Here are 6 vegetables that kidney patients should avoid or limit carefully. Number 1. The kidney disease vegetable that causes acute failure. Rhubarb. Rhubarb contains a staggering 1,336 milligrams oxalates per 100 grams, nearly 20 times higher than most vegetables. A documented clinical case shows exactly why this matters. A diabetic patient eating 500 grams daily for 4 weeks developed acute renal failure. The patient's kidney biopsy revealed massive oxalate crystal deposits throughout the kidney tubes. Creatinine levels shot up to 3.6 milligrams per deciliter, while kidney function dropped to just 13.3 milliliters per minute. This represents severe kidney failure requiring immediate medical intervention. Even cooking rhubarb doesn't make it safe. Studies show cooking reduces oxalates by only 70%, leaving dangerous levels that can still form crystals in compromised kidneys. Never consume rhubarb if you have any stage of kidney disease. Number 2. Winter squash, hidden renal diet food trap. Winter squash varieties pack 250 to 445 milligrams potassium per half cup serving. Butternut squash delivers 291 milligrams potassium in just half a cup cooked, well above safe limits for advanced CKD patients. DaVita clinical guidelines specifically warn against winter squash for potassium-restricted diets. The danger lies in hyperkalemia. Blood potassium above 5.5 milliequivalents per liter can trigger fatal heart rhythm problems. Kidney patients often don't realize winter squash differs dramatically from safer summer varieties. The concentrated flesh means small portions deliver large potassium doses, making blood level management extremely difficult. This includes butternut, acorn, delicata, and kabocha squash. Only spaghetti squash remains lower in potassium at around 181 milligrams per half cup. Always check labels on pre-cut squash packages, as serving sizes can be misleading. Number 3. Brussels sprouts. The 500 milligrams potassium bomb. Brussels sprouts contain 504 milligrams potassium per cup cooked, more than double the safe serving limit for kidney patients. The American Kidney Foundation explicitly lists Brussels sprouts among high potassium vegetables, requiring strict restriction in advanced CKD. Even half-cup servings provide substantial potassium load for patients with reduced kidney clearance. The concentrated nature means you get dangerous levels in seemingly small portions. Many patients assume all green vegetables are safe, making Brussels sprouts a common mistake. The cabbage family connection misleads people since regular cabbage is kidney safe, while Brussels sprouts are not. These small vegetables pack concentrated minerals that add up quickly. Just 10 to 12 Brussels sprouts can exceed daily potassium limits for advanced kidney patients. No preparation method significantly reduces this potassium content. Number 4. Okra, double threat kidney disease. Vegetable okra poses dual risks through moderate potassium content, combined with high oxalate levels at 56.3 milligrams per 100 grams. This combination creates problems for kidney patients managing both potassium restrictions and stone prevention. Nephrology stone prevention guidelines classify okra as high oxalate, contributing to calcium oxalate stone formation. The mechanism involves increased urinary oxalate excretion, promoting stone development that can obstruct already compromised kidney function. The slimy texture comes from mucilage, which doesn't reduce the mineral content. Cooking methods like frying or stewing don't significantly lower oxalate levels, making okra consistently problematic. Many southern and international dishes feature okra prominently, making it hard to avoid in certain cuisines. No safe preparation method exists for kidney patients with oxalate sensitivity or advanced potassium restrictions. Number 5. Parsnips, the preparation-dependent problem. Parsnips contain 200 to 350 milligrams of potassium per half cup serving, placing them in the dangerous category for kidney patients. The American Kidney Foundation includes parsnips among vegetables, requiring double boiling leaching methods for advanced CKD patients. Without proper preparation, parsnips contribute significantly to hyperkalemia burden, especially dangerous for patients taking ACE inhibitors or ARBs. These medications further reduce potassium excretion, making dietary sources more problematic. The leaching process requires slicing parsnips thin, soaking for hours, then boiling twice with water changes. This complex preparation removes only 40 to 50% of potassium, still leaving moderately high levels. Most kidney patients lack time or knowledge for proper leaching techniques. The risk of inadequate preparation outweighs potential benefits, making parsnips unsuitable for most CKD diets. Our final problematic vegetable combines high oxalates with excessive sodium content that creates multiple kidney risks. Number 6. Swiss chard, the high-sodium, high-oxalate threat. Swiss chard contains 379 milligrams oxalates per 100 grams cooked, ranking among the highest oxalate vegetables. This level significantly increases kidney stone risk, particularly dangerous for patients with existing kidney damage. The sodium content adds another layer of concern. 1 cup cooked Swiss chard provides 313 milligrams sodium, problematic for kidney patients managing fluid retention and blood pressure. This combination of high oxalates and sodium creates dual stress on compromised kidneys. Unlike spinach, Swiss chard's thick stems concentrate both oxalates and sodium. Removing stems doesn't sufficiently reduce these compounds to safe levels for kidney patients. The colorful varieties, red, yellow, rainbow chard, contain similar oxalate levels despite different appearances. No preparation method adequately reduces both sodium and oxalate content to kidney-safe levels. Now that you know which vegetables help and which harm, here's how to safely prepare them for maximum kidney health benefits. Evidence-based preparation protocols can dramatically reduce harmful compounds while preserving beneficial nutrients. These scientifically validated methods enable broader dietary variety for CKD diet vegetables while maintaining safety. Hot water soaking achieves significant mineral reduction with quantified effectiveness. Clinical studies show 40 to 49% potassium reduction in leafy vegetables using a 5-to-1 water-to-food ratio. Soak vegetables in previously boiled water cooled slightly for 5 to 10 minutes. Non-leafy vegetables achieve 30 to 39% reduction using this method. Double cooking provides maximum potassium reduction through a boil-rinse-boil protocol. Studies demonstrate 50 to 75% potassium reduction in properly prepared vegetables. The process slice vegetables 1/8 inch thick. Soak minimum 2 hours in 10-to-1 water ratio. Cook using 5-to-1 water ratio, drain completely. Then cook again. Food safety becomes critical for kidney health nutrition, since CKD patients have compromised immune systems. Avoid the 40 to 140 degrees Fahrenheit danger zone with maximum 2-hour exposure. Clean preparation includes 20-second hand washing, sanitized surfaces, and separate cutting boards for raw meat versus vegetables. Individual monitoring remains essential. Blood potassium and phosphorus levels guide personalized approaches. Some patients tolerate moderate potassium vegetables after leaching, while others require stricter restrictions. Regular lab work helps determine which preparation methods work for your specific kidney function level. Always consult your nephrologist before adding new vegetables to your diet, even with proper preparation methods. The research shows that smart vegetable choices may significantly impact kidney disease progression. The 4 kidney-friendly options, cabbage, cauliflower, cucumber, and green beans, offer safer nutrition when prepared correctly. Avoiding the 6 problematic vegetables helps prevent complications. However, every kidney patient has unique needs based on lab values, medications, and disease stage. This information doesn't replace medical advice from your nephrologist or renal dietitian. Always discuss dietary changes with your healthcare team before implementation. Start slowly with any new foods and monitor your response. Regular lab work remains essential for tracking how dietary changes affect your kidney function and mineral levels. If this kidney-friendly vegetable guide helped you make safer food choices, Please like this video and subscribe for more evidence-based kidney health content. Hit the notification bell so you never miss updates that could benefit your kidney journey. Share this with anyone managing kidney disease.